WCNC Charlotte, this is Flashpoint.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. May is Mental Health Awareness Month, and folks all across the Carolinas are bringing attention to this nationwide crisis. It is a deep and personal topic for a lot of folks, especially for our kids. In fact, suicide, the second leading cause of death for kids between the ages of 10 and 18. Coming up in a few minutes, we're going to speak with a Charlotte woman pushing to stop suicides, and she's doing it in a really unique way. But first, joining us now is Jaren Doby. He's a psychotherapist for Novant Health. Jaren, thanks for coming on. We appreciate it.
Thank you so much for having me.
So it is National Mental Health Awareness Month. I don't believe this was a thing several, decades ago. So do you think that we are making meaningful progress in talking about these things like mental health, or are we still just paying lip service to it and not really getting down to the root of the problem that is, by all accounts, a national problem?
I'm a fond believer of that no press is bad press, you know what I mean, at the end of the day. So ultimately being able to put more eyeballs on mental health, having more conversations, seeing more commercials, just seeing more attention being paid to it can never be a bad thing.
We're entering a period of time that suicides are actually the highest. People often associate depression with the winter months, but it's also an issue in the spring and summer. Why is now a time that it deserves so much attention?
Mental health is something that always deserves our attention because it is something that folks deal with every single solitary day. I mean, statistically, 1 in 4 adults deal with a mental health related illness or disorder in a given year. That's very much so significant. And more folks are actually coming out and being able to discuss the issues that it is that they've been dealing with mental health, when beforehand, of course, like the stigmas and stereotypes and things of that nature, resources may have prevented them from actually being able to express any of this. So it's always been important, and it will remain to be important, that everyone definitely make sure that they pay attention to their mental health.
That brings me to the question of, do you feel like mental health issues are worse now, or are we just more comfortable talking about it?
Yeah, I would say that that's a slippery slope to say that things are worse. I feel like that more people are coming out and being able to express those things. So don't be shocked if like certain statistics actually begin to grow, not for the fact that it's happening to more people necessarily, but it may just be that more people are actually taking an opportunity to report these things. So we have to make sure that we're paying attention to that, because it's always good for folks to actually come to the forefront and actually tell someone that what it is that they are dealing with. So when we see those numbers rise, or if we see more people coming out to talk about it, that means that we have more people that are actually, like I said, shedding the stigma or taking an opportunity to be more comfortable in being able to express themselves as it does pertain to their mental health.
In your experience, in your practice, how have things changed post-pandemic versus, say, the year 2019 versus the year 2023? What's different?
I would say between the last couple of years, and I would say within the COVID years, there's just been a huge boom in the world of mental health. What do I mean by that? There are more folks that are actually coming out to seek services, following up with their doctors, asking for recommendations, seeking referrals, actually taking an opportunity to ask for help. So this is one of those things that we can't turn our nose up or down to, that folks are actually seeking help. COVID was definitely one of those things that I say was just the rocket that really sent mental health into the stratosphere, and really making sure that more folks are aware of services that are around, but being more comfortable to take advantage of services is something that we've seen a significant rise in. So this is never a problem.
The pandemic also changed sort of how we interact with our doctors. Telehealth, it was around before the pandemic, but it certainly became much bigger during the pandemic. What are the pitfalls and obstacles that come with something like telehealth? I know it can be a positive, but are there limitations for what you feel like you can do?
Right. I'm a fond believer of, and especially my clinical opinion, that there's no such thing as one size fits all. There may be some folks that are very much so comfortable in being able to meet with a provider virtually. This is something that can create convenience for folks, right? They're also in the comfort of their own homes or in a place where it is that they are most comfortable to be able to speak. But also at the end of the day, this may be an inconvenience for folks as well. everyone is not dealing with the same kind of technology that is up to date, more so than anything, in order to be able to take advantage of an actual virtual visit with a provider. So it's important to make sure that we are acknowledging that as well, and making sure that services are provided for folks in person, if that's what it is that they actually do desire. So I most certainly encourage folks to make sure that they pay attention to what it is that they are most comfortable with, and being able to seek a provider that will be able to accommodate them.
In your practice, just anecdotally speaking, what do you see as the biggest pressing issue that most patients are dealing with? Is it anxiety? Is it depression? Are there any common through lines that you see throughout your practice?
As far as any trends or common diagnoses and things of that nature, I wouldn't be able to say that that's actually true. I would say that it's pretty much a mixed bag. Every patient that it is that I see can be dealing with something different. At the end of the day. Why? Because we as individuals are very much so very different. So it can be from the lines of depression, anxiety, any kind of trauma that it is that they've experienced, young children and adults, and dealing with ADHD and things of that nature. And of course, more of the diagnoses that incorporate psychosis of some kind. So we're ready for anything that very much so comes our way here at Novant, but it's definitely been folks coming in dealing with different issues for sure.
And it's a good reminder also for folks who are watching this, listening to this. What are the resources out there available for people who do need help?
I always like to bring attention to the 988 contact number for emergency mental health needs or suicide risk. I like to tell folks, think 911 for physical emergencies, think 988 for mental health emergencies. It was a 1-800 number, if I'm not mistaken. That number is actually still operational, but it's a lot easier to be able to dial the 988 number. You can talk with a trained crisis professional that is located in your catchment area, that is very much so aware of the resources that are available to you, to be able to make sure that they provide good references, but good help to you in the moment. It remains to be important that folks definitely make sure that they become aware of that number, put it in your phones, stick it to your refrigerator, take an opportunity to make sure that you're very much so aware, because you'll never know when a mental health crisis will occur, and being aware of such resource that you can literally get your hands on and speak with somebody 24/7 is very much so important.
Yeah, and final question here on this being the National Mental Health Awareness Month. What is your tip to folks who might not have their mental health at the top of their mind, but also want to keep self-care in mind and do want to be proactive about taking care of their mental health?
I would say definitely make sure to take an honest inventory, of how it is that you are feeling on a day-to-day, what thoughts are coming to mind, and what behaviors are kind of manifesting as a result of those thoughts and feelings combined, of course. It is very much so important that folks begin to practice mindfulness, and really making sure that they are aware of how their thoughts impact their feelings and how their feelings impact their behaviors. This can be signs that there is something on the horizon as it relates to issues to be addressed with your mental health. So if things are just a little bit different and you're noticing that, or it's a little bit harder for you to be able to cope with what it is that you are dealing with naturally in your life, it's important to make sure that you do seek the opinion of a professional in order to make sure there isn't anything serious going on, or to make sure that you begin to get treatment so that things don't worsen in any particular way.
Taking that honest inventory, a good thing to keep in mind. All right, Jaren, Doby, thanks for coming on. We appreciate it.
Thank you so much for having me. I hope you have a great day.
You too. More Flashpoint after this.